Hello everyone, myself Dr. Vallabh Chawla, and today we'll be doing a case study of presence of suspected fine crack lines as seen in the lower right side region. So patient had basically came with a chief complaint of pain in the lower right side region while chewing his food. So since patient was unable to localize the pain, so we took a sectional CBCT of lower right side which included the first molar, second molar and the third molar. So as when we took the CBCT scan, this is how the CBCT scan looks like. So this is of 2 thickness, so we just decreased the thickness to 1 We noticed that there was a suspected fine radiolucent crack line like appearance. Just to be sure, we can decrease the thickness to 0.5 and now the fine crack line is very well visible over here. As seen, the radiolucent line is well seen. Same way, we can just view this thing in 0.0 thickness. But however, decreasing the thickness to 0.0 will also increase the image noise. Though the radiolucent line may appear to be prominent, but however the image noise may increase. So it is well visible in 0.5 thickness. We can increase the sharpness filter. We can very well see the radiolucent crack line. So also on the distal root of 4-7 region, we'll see some sort of PDL widening as it is seen in the distal root. Okay, this is the distal root. We'll just arrange it along the long axis of the tooth root. So this is along the long axis of the tooth root. You can see some kind of radiolucency in the periapex region. This is the radiolucency. So this is a typical case of fine dentinal crack line, or you can we have to evaluate for cracked tooth syndrome as well by making a patient choose some kind of bite block or any object just to evaluate if there's cracked tooth syndrome. Whenever the bite is released and patient is having some kind of tooth pain, then it is suggestive of cracked tooth. Okay, so coming to the mesial root, this is the mesial root. Arrange it along the long axis of the tooth root. Okay, so as seen on the mesial root, this is the mesial root. It appears to be fine. Only the PDL appears to be widened in the mesial root. However, in the distal root, periapical pathology has started. The boundaries of PDL space is partially lost in the lower, has widened, and the lamina dura seems to be initially lost at the apical 1/3 region, and there is initiation of pathosis or abscess. Okay, so also note the presence of there is suspected pulp canal stone. So basically, pulp stone. So pulp stones are basically nodular calcified masses. They occur either attached to the dentine or may roam freely in the pulp canal. They are usually made up of they are irregular in shape, and basically they are made up of dentinal cells or degenerating odontoblast cells. And the treatment includes proper instrumentation with the while performing the root canal, and care needs to be taken while removing the pulp stone. Also, if the root canal procedure is planned, so there is no evidence of middle mesial canal, only the mesiobuccal canal is seen, the mesiolingual canal is seen, and the distal canal is seen. Okay, you can see this thing in smallest cross sections also. This is the distal root of 4-7, and this is the mesial root of 4-7. Okay, this is the mesial root, and same thing, if you want, you can see it along the long axis, like in the axial cross sections. You can see this by decreasing the interval lines to, for example, 0.5 to just to have a closer look of the crack lines. But however, crack lines are very well viewed in the sagittal section. So but still, in case if there is any evidence of crack line, we can give a marking on it, and also it needs clinical evaluation. Okay, so same thing can be seen in the sagittal cross section also. What we'll do is we'll just delete this line and just arrange the patient along the long axis, and instead of, we'll just mark the CMPR like this. And now going this way, you can just notice in the sagittal cross section there may be some kind of radiolucent line. We'll just delete the mid sagittal line, and we'll just notice it over here. Some kind of crack line may be evident. Okay, so we just have to mark it over there. Okay, the mesial root seems to be widened. Mesial root canal periapex seems to be widened, and the distal root canal periapex seems to be show initial loss of lamina dura, which is suggestive of initial signs of periapical pathology. Okay, so this was all about periapical pathosis, which was caused due to micro crack lines, and it also requires clinical evaluation for the same. Okay, to evaluate to come to a final diagnosis of cracked tooth syndrome. Okay, thank you so much.